If you or someone you love is over the age of 60, please listen carefully. What I'm about to say could mean the difference between life and sudden disability. Strokes do not always come with warning signs. In fact, many seniors feel fine the day before a stroke happens. They walk. They talk. They eat dinner with their families. And then, suddenly, everything changes. As a doctor who works with elderly patients, I've seen it too often. The truth is, strokes in older adults are rarely random. Most of them are the result of habits, medical conditions, and age-related changes that have been silently building up over time. High blood pressure that was never fully controlled, a heart rhythm that's been irregular for months, sleep that's never quite restful. And sometimes, it's not just about what's wrong with the body, but about what's missing: exercise, good nutrition, or proper medical follow-up. What shocks me most is that many of these strokes could have been prevented if only someone had connected the dots earlier. That's why in this video, I want to walk you through the real causes of stroke in the elderly. Not just the obvious ones like smoking or heart disease, but also the hidden ones. We'll talk about how cancer treatments, low blood pressure, and even the natural changes of aging can make the brain more vulnerable than you think. My goal is simple. I want to help you understand what's happening inside the body as we age. And more importantly, what you can do to lower your risk starting today. Because a stroke doesn't just affect the brain. It affects your ability to live, to speak, to move, and to be present with the people who matter most. So let's begin. This information might just save a life. 1. High blood pressure and cardiovascular conditions. Among all the risks faced by older adults, high blood pressure remains one of the most dangerous and most silent. You may feel fine. You may not notice any symptoms. But inside your body, high pressure is constantly wearing down the walls of your arteries. It weakens them. It stiffens them. And over time, it creates the perfect conditions for a stroke. I've seen seniors who thought their blood pressure was just a little high for years. They ignored it. Or they trusted it would get better on its own. Then one day, they collapsed. Some recovered, others never spoke or walked again. But high blood pressure is not the only heart-related issue we need to talk about. Atrial fibrillation, which is an irregular heartbeat, is another major cause of stroke in older adults. When the heart does not beat in rhythm, blood can pool and form clots. And if one of those clots travels to the brain, the result is often sudden and devastating. I've treated patients who had no idea they even had this condition. It can be quiet. It can come and go. And it often hides behind symptoms like fatigue or a fluttering chest. Heart failure and coronary artery disease also raise stroke risk significantly. When the heart is struggling to pump blood effectively, the brain may not get the steady, healthy flow it needs. Reduced circulation means less oxygen, more stress on the vessels, and a higher chance of a blockage or a bleed. These are not rare conditions. In fact, studies show that a large number of strokes in seniors can be traced back to problems with the heart. What worries me most is how often these conditions go untreated or undertreated in older adults. Sometimes it's because people are afraid of taking too many medications. Sometimes it's because the symptoms are subtle or mistaken for aging. But in reality, managing blood pressure and heart health is one of the most powerful ways to prevent a stroke. That means regular checkups. That means listening to your doctor. That means making changes even when you don't feel sick. Your heart and brain are deeply connected. When one suffers, the other is at risk. But the good news is, this many of these conditions can be controlled. And the earlier you act, the better your chances of avoiding a stroke. So if you or a loved one has high blood pressure, an irregular heartbeat, or any kind of heart condition, take it seriously. Because what feels like a small issue today could become a life-changing crisis tomorrow. 2. Lifestyle habits that add fuel to the fire. When it comes to stroke prevention in older adults, many people think about medication, genetics, or age. But there is another layer that often gets overlooked: lifestyle. The habits we choose every single day can either protect the brain or quietly destroy it over time. And, unfortunately, some of the most common routines: smoking, excessive drinking, poor diet, and lack of movement are doing more damage than most seniors realize. Let's start with smoking. I've seen older patients who say, "I've been smoking for decades. It's too late to quit." But the truth is, it's never too late. Every cigarette sends toxic chemicals through the bloodstream. These chemicals damage the lining of your blood vessels. They encourage plaque to build up. They raise your blood pressure and increase your heart rate. The result: a significantly higher risk of stroke. In fact, smoking alone can raise stroke risk by nearly half. Quitting at any age, even in your 60s, 70s, or 80s, can lead to real improvements in vascular health. Next, let's talk about alcohol. A glass of wine or a small drink on occasion may not be harmful, but drinking more than that, especially on a regular basis, can raise your blood pressure, interfere with your heart rhythm, and contribute to liver and brain inflammation. These are not harmless side effects. They are direct pathways toward a stroke. And in seniors, the body is less equipped to recover from that kind of damage. Now, let's address inactivity. Modern life makes it so easy to sit all day. Television, smartphones, and even comfortable recliners have created a culture of stillness. But your blood was made to move. When you sit for long periods without standing or walking, circulation slows, blood can pool in the legs, clots can form, and pressure builds in your arteries. These changes don't happen overnight, but they accumulate, and by the time symptoms appear, it may be too late. Just 30 minutes of walking each day can make a real difference. Finally, diet. Many seniors eat what they've always eaten, not realizing their body's needs have changed. High salt, high sugar, and fatty foods can raise cholesterol, spike blood pressure, and promote diabetes. All of these contribute to the slow buildup of plaque inside your arteries. Think of it like rust building inside a pipe. One day, that pipe gets blocked or bursts. That is what happens in a stroke. So what's the lesson here? It's simple. You are not helpless. Every lifestyle habit is a choice. And every positive change you make, whether it's quitting smoking, drinking less, walking more, or eating better, can lower your risk and strengthen your body's defenses. Stroke is not just a matter of chance. In many cases, it's the result of daily patterns that quietly set the stage for a crisis. Break the pattern now, and you give yourself the chance to live longer, stronger, and more independently. 3. Metabolic disorders that damage blood vessels over time. Many older adults assume that if they're not feeling pain or discomfort, their body must be doing fine. But when it comes to metabolic disorders like diabetes and high cholesterol, the danger isn't loud or sudden. It's quiet, it's slow, and it's deadly. These conditions are often called silent killers for a reason, because by the time you feel their effects, the damage has already been done deep inside your blood vessels. Let's begin with diabetes. It's not just a sugar problem. Diabetes affects how your entire body handles energy, inflammation, and blood flow. When your blood sugar stays elevated for years, it damages the inner walls of your arteries. These damaged areas become sticky. They attract fats, calcium, and other materials that form plaque over time. This buildup narrows the arteries and reduces the flow of oxygen-rich blood to your brain. That's how a stroke happens. And it's important to know that even pre-diabetes, when your blood sugar is high, but not yet in the diabetic range, can still increase your risk. Then there's high cholesterol. Many people imagine cholesterol as something floating in the blood, but it's more than that. When there's too much LDL cholesterol, the so-called bad cholesterol, it doesn't just float. It sticks. It clings to the damaged walls of your arteries and hardens into plaque. This plaque narrows the blood vessels, restricts blood flow, and can break apart, forming clots. If one of those clots travels to the brain, it can block a blood vessel and trigger a stroke. What's worse? You may not even know your cholesterol is high unless you get tested regularly. The combination of diabetes and high cholesterol is particularly dangerous. Together, they create a perfect storm inside your blood vessels. They not only cause inflammation and blockage, but also make it harder for your body to heal. The immune system weakens. The arteries become stiff. The heart works harder. And your risk of stroke rises with every passing year. The good news is that both of these conditions can be managed. A healthy diet, regular exercise, routine medical checkups, and in some cases medication, can all help keep your blood sugar and cholesterol within safe limits. Simple changes like cutting back on processed foods, drinking more water, walking after meals, and choosing whole grains can make a measurable difference. So if you've been told you have diabetes, high cholesterol, or even just borderline numbers, don't wait. Don't ignore it. These are not harmless labels. They are early warnings. And if you take action now, you can protect your brain, your heart, and your independence. The damage from metabolic disorders may happen slowly, but the consequences can strike in an instant. And when it comes to strokes, prevention is always better than recovery. 4. Specific stroke types that often go undiagnosed. Not all strokes announce themselves with dramatic signs like facial drooping or sudden collapse. In fact, some of the most dangerous strokes in older adults are the ones that go unnoticed, undiagnosed, or mistaken for something else entirely. These silent threats quietly chip away at brain function until the damage becomes too great to ignore. One of the most overlooked types is the cryptogenic stroke. This is a stroke with no known cause. Even after extensive testing, doctors may not be able to determine exactly why it happened. For many seniors, this means the underlying problem, like a hidden heart rhythm issue or a minor blood clot, remains untreated. Without knowing the cause, it's difficult to prevent another one from occurring. Unfortunately, cryptogenic strokes are common among the elderly and often missed unless the patient insists on thorough follow-up care. Another commonly missed type is the cardioembolic stroke. This happens when a clot forms in the heart and travels to the brain. Conditions like atrial fibrillation, which causes an irregular heartbeat, are often behind these strokes. The danger is that many seniors with atrial fibrillation don't feel any symptoms. They may go undiagnosed for years. while tiny clots form silently and increase their stroke risk each day. Without routine heart monitoring, this kind of problem can slip through the cracks. Then there are strokes caused by small vessel disease. These occur deep within the brain where small arteries gradually become narrowed or blocked. The symptoms may be subtle, a moment of confusion, a loss of balance, or a minor speech difficulty that quickly passes. Many older adults dismiss these signs as just getting old. But these small strokes accumulate over time and can lead to a major event or even a form of dementia known as vascular dementia. Hypotensive strokes are another example. These are caused not by clots or bleeds, but by a sudden drop in blood pressure that starves the brain of oxygen. This can happen during heart failure, internal bleeding, or even after a severe infection. These strokes are especially common in frail older adults who may already have low blood pressure. Because the cause is not inside the brain but elsewhere in the body, they're often missed or misdiagnosed. The tragedy is that these types of strokes could often be prevented or minimized with the right vigilance. Regular heart screenings, blood pressure management, and cognitive assessments are essential. So, is paying close attention to small changes a bit more forgetfulness? A stumble. A word that won't come out right. These aren't always signs of aging. Sometimes, they're the brain calling out for help. If you or someone you love is over 60 and has risk factors like heart disease, diabetes, or prior strokes, do not wait for dramatic symptoms to act. Some strokes don't come with warning bells. They come quietly, and they stay. 5. Sudden drops in blood pressure that kill silently. When most people think of strokes, they imagine a clot blocking a vessel or a hemorrhage inside the brain. But there's another, quieter killer that strikes without warning. It's not caused by what clogs the blood vessels, but by what stops blood from reaching the brain in the first place. I'm talking about acute hypotension, those sudden, sharp drops in blood pressure that deprive the brain of oxygen-rich blood, even for just a few moments. This type of stroke is especially dangerous for older adults. Why? Because aging bodies have a harder time regulating blood pressure. Medications, dehydration, heart problems, or even standing up too quickly can lead to a rapid decline in blood flow. And when the brain doesn't get the oxygen it needs, neurons begin to die. Not in hours, in minutes. Take, for example, a 75-year-old man with heart failure. His blood pressure is already borderline low. One evening, he develops an irregular heartbeat. Or maybe he bleeds slightly internally from a hidden ulcer. The result is a sudden drop in circulation. He feels lightheaded, maybe slumps into a chair, and then he's unresponsive. By the time help arrives, the stroke has already happened, and recovery, if it happens at all, is slow and incomplete. Unlike ischemic or hemorrhagic strokes, hypotensive strokes don't leave an obvious trail on scans. They're often mistaken for fainting spells, low blood sugar, or even just fatigue. But the consequences can be permanent memory loss, confusion to speech problems, or paralysis. And because they're frequently missed, the underlying causes aren't treated, making a second event more likely. This is why seniors with heart disease, arrhythmias, or recent infections must be monitored closely. Even mild dehydration from a hot day or a skipped meal can tip the balance. Medications that lower blood pressure, like diuretics or some heart drugs, must be managed carefully. Physicians often walk a fine line between reducing blood pressure to prevent clots and keeping it high enough to maintain cerebral perfusion. The solution isn't to panic over every dizzy spell, but it is to pay attention. Track blood pressure regularly, especially after changes in medication. Be cautious with rapid position changes. Rising too quickly from bed or a chair can cause orthostatic hypotension, another silent trigger. And if an older adult shows signs of weakness, confusion, or slurred speech, assume the worst and seek immediate care. In the world of stroke prevention, high blood pressure gets most of the attention, but low blood pressure, especially sudden drops, can be just as deadly. The brain needs steady, consistent flow to survive. When that flow is interrupted, even briefly, the cost can be irreversible. 6. The aging body's natural vulnerabilities. As a doctor, one of the hardest truths I must often explain is this. Sometimes, even without bad habits or underlying disease, the aging body alone can set the stage for a stroke. You see, as we grow older, our bodies change in subtle yet powerful ways. These changes affect everything from the elasticity of blood vessels to how the brain handles inflammation, blood flow, and recovery after injury. Let's start with the immune system. In younger people, the immune response is quick, targeted, and efficient. But in the elderly, this system becomes dysregulated. When a stroke occurs, the body needs to clear away damaged cells and promote healing. Yet in older adults, the immune system tends to overreact. Instead of helping, it floods the brain with inflammatory chemicals that do more harm than good. It's like sending a demolition crew to repair a damaged wall. The response is too aggressive, and healthy tissue gets caught in the crossfire. Then there's the vascular system. With age, blood vessels become stiffer and more prone to plaque buildup. The delicate lining inside the arteries, known as the endothelium, becomes less efficient at controlling blood pressure and clotting. Homocysteine, a natural amino acid that rises with age, builds up silently and damages those vessels further. These invisible changes make arteries more fragile and easier to rupture or block, even in people who seem otherwise healthy. The autonomic nervous system also weakens with time. This system controls involuntary processes like blood pressure regulation and heart rate. In a young person, the body reacts instantly to drops in blood pressure by tightening blood vessels and increasing heart rate. But in older adults, these adjustments are slower and often incomplete. That delay can mean the difference between staying conscious and falling into a stroke-inducing blackout. And we must not forget the mitochondria, the energy factories inside each cell. In younger brains, they recover from oxygen deprivation relatively quickly. But in older brains, their response to injury is less flexible. They produce harmful byproducts like free radicals, which worsen the damage from a stroke and slow down recovery. What this all means is simple but sobering. Even with a perfect lifestyle, age alone increases vulnerability. The body's protective systems are less efficient. The brain has less reserve. And when something goes wrong, whether it's a clot, a bleed, or a pressure drop, the consequences are often more severe and longer lasting. So, what can we do? We can't turn back time, but we can work with what we have. That means being proactive, regular checkups, cautious medication management, and quick response to any warning signs like slurred speech or sudden weakness. It also means accepting that prevention must start before symptoms appear. By understanding the body's natural decline, we can better protect the brain from catastrophe. 7. Cancer and its surprising connection to stroke. When we talk about cancer, We often focus on the tumor itself or the treatments designed to stop it. But what many patients and even some doctors overlook is that cancer by its very nature can quietly increase the risk of a stroke. This is not simply because cancer patients are weaker or more fatigued. The connection runs much deeper, rooted in how cancer disrupts the body's ability to regulate blood and clotting. Here's what most people don't realize. Cancer changes the blood. Certain tumors, especially in advanced stages, trigger the body to enter a hypercoagulable state. That means the blood becomes more likely to form clots. Why? Because cancer cells release substances that stimulate clotting activity. These aren't just theoretical risks. These are physical changes taking place in real time. Suddenly, the same clots that form in the legs or lungs may dislodge and travel to the brain, blocking a vital artery. And when that happens, a stroke can occur without warning, without any prior history of cardiovascular disease. What's more, cancer treatments like chemotherapy and radiation can further aggravate the problem. Some chemotherapeutic agents damage the lining of blood vessels, making them more prone to injury. Others suppress the immune system or trigger inflammation, both of which can contribute to clot formation. And in elderly patients whose vascular systems are already compromised, that added stress can become the final straw. Studies now show that stroke is not just a random complication in cancer patients. In fact, it's becoming a more common cause of death among them, especially as modern medicine helps people live longer with cancer than ever before. Ironically, as we succeed in treating the cancer itself, we're uncovering a new enemy hiding in plain sight: stroke. This risk is highest in the first few months after a cancer diagnosis, particularly with certain types of tumors like pancreatic, lung, and gastrointestinal cancers. It's not rare, it's not accidental, and it's not always preventable. But it can be better understood and better managed. So what should patients and caregivers do? First, recognize that stroke symptoms in cancer patients may be overlooked or misattributed to fatigue or medication side effects. Sudden confusion, numbness, or difficulty speaking should never be dismissed. Second, doctors must remain vigilant. If a patient is undergoing chemotherapy and begins showing signs of weakness or dizziness, imaging and clotting tests should not be delayed. Finally, in some high-risk cases, preventive blood thinners may be considered, but only under strict medical guidance. Cancer already demands incredible resilience, but by shedding light on this hidden connection to stroke, we can give patients and families a fighting chance to recognize the signs, reduce the risks, and respond before it's too late. Conclusion and doctor's final words. If you've stayed with me through this journey, you now understand one thing. Clearly, strokes in older adults don't just happen out of the blue. They are rarely accidents. They are almost always the result of silent forces, building up over time, forces we can see, measure, and in many cases, control. High blood pressure, smoking, diabetes, heart disease, poor sleep, even cancer. These are not just medical terms. These are signals, warnings, opportunities, and the most dangerous thing we can do is ignore them. The aging body is vulnerable. Yes, but it is not helpless. With the right awareness and a proactive mindset, many strokes can be prevented. It starts with checking your blood pressure every week, then looking at your plate. Is it filled with real, nourishing food, or processed sodium bombs that silently raise your risk? Then ask yourself, are you moving enough? Even a 15-minute walk can change your vascular health more than any supplement ever could. Look at your habits. Are you still smoking? Still drinking more than a small glass? Still skipping sleep to watch just one more episode? Each of these choices may seem small in the moment, but over time, they add up. They build pressure on your heart, on your brain, on your future. And then, one day, without warning, the body says enough. If you are living with chronic illness, if you are caring for a parent with cancer, if you have already had a small stroke or even just a few symptoms, you are not alone. But you do need to act. Talk to your doctor. Ask about your risk. Get the tests. Take the medication. Change the habits. Every small step matters. Every decision is a vote for the future you want. And if you are still healthy, still strong, still walking every morning and thinking, this could never happen to me, I hope this message stays with you. Because stroke does not discriminate. It does not wait for weakness. It punishes neglect and rewards vigilance. As a brain doctor, I've seen the devastation. I've watched families shatter in a single night. But I've also seen something else. I've seen people turn things around, reverse their numbers, rebuild their strength, reclaim their life. That is what I want for you. Stay informed. Stay consistent. Stay alive.